from a patient perspective, why would you do this? And all of these things that I'm about to propose, they all make sense, but they've never really been completely proven in any study. And I want to kind of get back to that several times because we're in the process of developing a randomized prospective trial looking at this in our sternotomy patients. I have lots of anecdotal experience. I've done, probably between 6,000 and 8,000 cardiac cases, but in terms of how many I've used the Cryo Nerve Block for, it's probably around 120 or so. I've been very happy with it. And some of the videos that Dr. Quinn showed, it's sometimes hard to really express that to your partners when you see these people moving around basically normally after their cardiac surgery, or when you see them in the office a month later. It's very profound. So obviously we want to do this to decrease pain. We want to get these folks moving around more, and we want to enhance their early mobility and enhance their breathing. And I think it's important to consider ways of decreasing the stress response as well. And we want to, of course, reduce the narcotic requirement. We want to reduce novel persistent opioid use, which we would define as new opioid use about 3 months or so after the index procedure. Could we potentially discharge the patients from the hospital faster? Again, these are all questions that I think are possible but haven't been demonstrated. Could we enhance wound healing related to decreased stress response? And, it's interesting when you talk to patients who kind of get through their CABG or their valve replacement, and you see them in the office, and they're, generally speaking, most of them are doing pretty well. But like, what about just the return to normalcy? And what about sleep? Everybody loses sleep after surgery, and it's really interesting to hear how well these people can sleep. When they can sleep on their side, or even some people sleeping on their stomach right after surgery.